Hi, I'm Dr. George Ho of Vancouver. This movie supplements the article that I'm going to republish soon. The article that has been published was published by Tai Chi magazine in 2015 in the summer issue, and that article does not have this part of material that relate Tai Chi and the spine. To give you one example of the uniqueness of this article is that many people might think that Tai Chi is a slow movement and could be used to rehabilitate the back, especially the low back after a bout of back pain. As a chiropractor with 3 decades of clinical experiences, I can tell you this is far from true. You have to be very careful when you select Tai Chi as a form of rehabilitative exercise for back pain. Many people do not understand that back pain is just the name of a symptom. It is not a diagnosis. Different kinds of back pain need different kinds of treatment plan. Some of those treatment plans are contradictory to each other. Many people might think that Tai Chi would strengthen the core muscle with zhang zhang and those slow movement and would be good for back pain because of bad posture. If the back pain is because of bad posture, it is. But if the back pain is caused by something shown in the picture called acute low back pain, medically known as posterior facet joint incarceration, Tai Chi is definitely contraindicated, which means it's bad for this. I'm going to use part of the movie I made to explain and to help people cure their lumbar disc herniation and acute low back pain to substantiate my claim that Tai Chi is not good for lumbar disc herniation and not good for acute low back pain. In my old article published in 2015, I have already explained why Tai Chi is good for sexual prowess. My claim is supported by solid medical evidence, and people who have read that old article published in 2015 will know what I have told everybody. This scientific explanation not only explains why Tai Chi will increase sex power, it would also explain why train and keep the spine with the 3 healthy curves and do not believe in the saying that straightening the curve will facilitate the passing of qi from the sacrum to the cranium, the head. I have told you my experiences with this Xiao Zhou Tian. I have already told you that this Xiao Zhou Tian is not very effective, especially when you do not have Bao Ping Qi. In my article that explains scientifically why the Ji form of power is so powerful, I have already pointed out that one practitioner had advocated people to do this training to straighten the spine, and it was not very good for him. That was in the old G form of Tai Chi Power article. I have a special movie on this. You can go back to the old movie and take a look at it. In this going to be published article, I have pointed out that Tai Chi is not very helpful for people with spinal stenosis, and then one form of spinal stenosis is called anterior listhesis, and then it is not good for piriformis syndrome, and also Tai Chi is not very helpful for people with sacroiliac joint dysfunction. If you are a patient with the aforementioned problems, or if you are using Tai Chi to do therapy, please take a look at this article that I'm going to publish soon, maybe the next few weeks or so. In this movie, I have to be technical to prove my point. The following is part of the movie that I use to teach people with acute low back pain and lumbar disc herniation. If you want to see the full movie, you can go to the link which is in the illustration down below.
Medically, acute low back pain is known as posterior facet joint incarceration. It is characteristic by a sudden, very severe sharp pain, and some patients claim that they haven't done anything. They just bend down to pick up a piece of paper, and then the sharp pain make them fall down on the floor. If you look at this picture closely, you'll understand why the pain is so severe. Each facet joint is like a set of pliers wrapped up by a synovial membrane, which is not visible here. When the small muscle, the intrinsic muscle deep inside the back, they're too tired. They cannot control the facet joint anymore, and the facet joint can pinch on the synovial membrane. It's like you accidentally bite the inside of your mouth, and then your teeth will not let go. You see how painful it is. This may sound terrible, but it's not difficult to treat. If I have to treat it, I just have to adjust the joint, release the pinching, and the patient is okay in 1 or 2 days. If you cannot find anybody to adjust the joint for you, all you have to do is lie down in bed for a week or so, take anti-inflammatory, and then you probably will be okay. But the problem is that if you do not rehabilitate the small muscle called the multifidus, this acute low back pain can recur. If you do not treat acute low back pain properly, you probably will get lumbar disc hernia because each level of the back is supported like a tripod, the two facet joints in the back and the disc in the front. If even one facet joint is not working, that side is weakened, and then the disc might protrude on that side. Luckily, the multifidus, the small intrinsic muscle of the back, they're not difficult to rehabilitate. The McKenzie exercise is the most commonly prescribed exercise.
I also have special movies on sacroiliac joint dysfunction and piriformis syndrome. I have put all those links in the illustration down below. You can go and look for them and follow them.
Hi, I'm Dr. George Ho. This concludes the movie. And if you like this movie, please click like and please share it with your friend in other media like that Facebook. And it would really motivate me to make more movies like this if you would subscribe to my channel. Thank you very much for watching. I'm Dr. George. Subscription is totally free.